Thank you for coming. Lovely to see you here today. I think in general, I was expecting a slightly different presentation, so I wrote myself some notes about housekeeping, which I'm going to have to change, but there's a Q&A where you can post questions, and hopefully the people on the panel will be able to engage and address the questions for you as we go. We'll try and keep track of them. So please do use the Q&A to let us know if there's anything you would like us to talk about. So we've put the session today to provide some more local information about the highlight notice from the NIHR, which is designed to encourage nurses and midwives to apply for funding to support health research. And we're really, I think a lot of us are really pleased about this. And we're really keen to hear from you and keen to try and support you to put bids through. I think some of you have signed up for one-to-one sessions later today, and we look forward to talking to you, but we're always here and available to talk to you if you put through a request, and there'll be instructions about how to do that later. So I'm going to be talking, or I'm going to be leading for about 50 minutes. There'll be plenty of opportunities during that time to ask questions, and we'll go through some of the Q&A that's been posted about this particular call. Then Jean will talk about the research design service and what we can do to help you. Dr. Sarah Vollum has kindly offered to talk to us about her experience of gaining research funding as well, and we hope you'll find that really instructive. So for the next few hours, we hope you'll find very useful. But please do contact us if you think we can help you further. And we're here to talk about research funding in general, not just about this call. So okay, I'm going to try and present. Now this might or might not work as intended. Hopefully somebody on amongst the presenters will tell me whether okay, helpfully it's showing me what's on the screen, which is good. Okay. So here we go. So I'm presuming you can see the presentation now. Okay. So oops, it's already jumped forward one slide. Here we go. Okay. So thank you for coming. So I'm going to be talking about the highlight notice from the NIHR through the Research for Patient Benefit Programme targeted at nurses and midwives. My name's David Wellstead, and I'm a senior research advisor in the Research Design Service East of England, but I'm representing the whole team. So any errors are mine, but I'm here to represent the region. I'm going to talk a little bit about the National Institute for Health Research for people who don't know what the NIHR is. Sorry, it's called the National Institute for Health and Care Research now. They've added the care in, so it covers a broad range of activity, as we'll see. The NIHR funding focus, the NIHR have decided to put out this highlight call focusing on nurses and midwives, and I hope you've read some of the background literature, and that's why we're here today. I'll go over some of the FAQs that have been posted on the national website, and then we'll have a Q&A session. Okay, so I completely can't see time, so I'm going to try and keep to time on this. Okay, so the NIHR, the National Institute for Health and Care Research, was established in 2006 and really got going, I think, in about 2008, where a lot of the reorganization had completed. Currently, the NIHR funds about 1.2 billion a year in research across the Department of Health and Social Care. I'm always a bit confused about what's included and what isn't included in the Department of Health and Social Care these days, but it covers anything to do with the NHS, social care, and public health. So there's a wide remit for funding now, and the NIHR is pushing hard to expand that remit and get research activity going in areas where there hasn't been research for a while. So the mission generally, overall, I'm going to jump through this quite quickly. There's a lot more information online if you want to have a look. But to improve the health and wealth of the nation through research. So that's its core aim. Just to clarify that a bit, it focuses on applied health research mainly. There are some more bench style work at the margins, but the most of the kind of research that we'll come across and you would be engaged in will be what's relevant to patients in practice. So it's the bedside end that the NIHR are interested in as far as we're concerned. So there's a number of core work streams. So funding research is quite a large proportion of what they do. There's research infrastructure as well. So there's a number of infrastructure units about that you may or may not be aware of, but that's a core activity. Patients and the public collaboration is huge. It's a really important area, engaging the patients and the public, the users of the services, in helping us to design research that's appropriate to what we're trying to achieve. And without their input, much research would be not as valuable as it can be. So that's really important. Research training, there's quite a large range of training programs, and we'll touch on that a little bit today, but that's also open to people who are interested. There's been really growing over the time since 2006, more and more collaboration with charities and industry. So there's the large charities like the Wellcome, Cancer Research UK, which are well known, but increasingly smaller research-focused charities are being brought on board. And so you can partner with charities quite well, and that's worth keeping in mind and looking at as well. And more recently, focus on funding for global health research. So that's being pushed. It was pushed quite radically at one point, and it's still there, but it's gone a bit quiet as far as I can see myself. But there you go. There's that area of activity as well. Broadly, in terms of funding, in terms of research funding and funding programs, there's three kinds of programs. There's areas that the NIHR and the NHS identify as important that they really want researchers to focus on. So they identify specific calls where there's a very well-defined remit, and those calls are put out on quite a regular basis across a number of the funding streams. There's also always and continuously researcher-led work streams where the topic of the bid is determined by the researcher. Although this particular call today is focused on nurses and midwives, the topic is up to you, and we can help you talk about that. We'll talk more about the kinds of support we can give you to help you design the research question you have, and it's whether it falls within the remit of the call. Last of all, there's themed calls, which highlight areas of priority. So accident, emergency, urgent care is quite a big issue at the moment. There's been calls on dementia, for example, theme calls. Those are quite broad descriptions of things that the service think are important and want researchers to focus on. So it's useful in the sense that the NIHR saying, these are important areas, please apply, which helps you. It helps because you don't have to then work really hard to explain why your bid is important to the NIHR. The highlight notices fit within the themed calls. They're similar, but slightly different. Okay. So the Research Patient Benefit Program is a really great program, and this particular call is being pushed through that research program. We've referred to it as RfPB, and you might hear that acronym. used quite widely. There's 10 areas in the UK where the panels are assembled. So your bid would be channeled through one of those 10 areas. We're in the east of England, so there's an East of England panel, and if you are in the east of England, your bid would generally be channeled through that panel, but it might go. Increasingly, some of the bids are going outside, but the point is that they are regionally based funding panels. The focus is really on daily practice and health and social care. It's a really useful program in the sense that it's lower in value. There's less risk for the NIHR, and it's there as much to encourage new people to come in who haven't necessarily held grants before and get experience of holding grants. So there's less of a focus on the history of the person applying and more on the research and the team you have around you to support. And we'll make that. We'll talk about that later as well. So the focus really is on a clear trajectory to patient benefit. So this is really focusing on the service end, on what's happening at the bedside and research, which is going to have a good chance of impacting on patient care in the short to medium term, so over the next sort of 3 to 5 years after completing the piece of research. There's been over 1,200 awards up to date, about £270 million, so it's not an inconsiderable amount of money that's channeled through this programme. Sorry, there's 8 regional advisory committees. There were 10 originally, there's 8 now. And there's a rolling set of calls. There's 3 calls a year, and that hasn't changed since 2008, so we don't expect that to change. So if you miss the upcoming call, there's always one 4 months down the line, and that 4 months comes quicker than you might imagine. And each call has a 2-stage process. We'll talk a bit about the process a bit later. I put the link to the program on the slide so that it's there, but if you search for Research for Patient Benefit NIHR, it'll come up on Google. I've put the slide up here, and I think this you should be able to have a look at these slides later, but it kind of gives you an idea of what the program will fund and what it won't fund, and I'm not going to dwell on this too much because we're here to kind of help you through that process and understanding what's in remit. But I'll focus on what the program won't fund, so you get an idea of what's out of remit very clearly. So generally laboratory-based research, anything that's basic, that's preclinical, that is earlier on in the research chain, so that it has less chance of having an impact on patient care, is not going to be in remit. So things like laboratory-based research infrastructure are really out of remit here. So those things you shouldn't be thinking about. Things that are solely service development, or audits, surveys, that kind of thing, are not on remit, apart from when they're part of a larger program of research, which would fit within the body, so it informs the research process. But if the question is solely about service development, then it won't fit. There's also priority setting programs out there, but that's not, and those are valuable in their own right, but they're not, they won't fall within the remit for this program. Okay, we will talk, I will give you some examples a bit later of the kinds of things that are relevant. So just to give you some idea, the scope of the program, the upper funding limit is £500,000 over 3 years, but the expectation is anything that goes up to that limit would be quite substantive, and and really have a chance of having an impact on patient care in the short term. So it has to be quite a substantive piece of work. I would expect new people not to be going up to that limit, so new researchers, that's quite a high bar and quite difficult to achieve. There's a second tier with £250,000. The soft ceiling has been introduced lately. There's obviously more flexibility around that ceiling now, but it is quite important to focus on keeping within the bounds of these limits. The kind of example they talk about here is something that's a substantive piece of research which would allow you to develop an idea. So in terms of, it wouldn't be, for example, a full randomized trial, it would be a smaller scale feasibility trial. I hate talking about trials when I'm talking to a wider audience, because not every piece of research is trial based, but you might be doing, for example, something that is around understanding how a service operates and works in terms of delivering care for patients, so that you can understand some fundamental principles about its operation and practice that will lead to being able to develop a better understanding of what needs to change and how you can deliver care better. So that would lead on to a large scale study later on. So that's the kind of thing that tier 2 is focused on. Tier 3 are generally the description originally is higher risk proposals. So what they mean by higher risk is things that are further from patient care. So this is early phase work. You might, for example, it's quite popular to use it for doing systematic reviews, where you are having a look across a range of papers to get a better overview of the evidence that exists currently to support a particular kind of concept or idea. That would then lead on to a more substantive piece of work focused on changing patient care. So there's a lot of examples that you can have a look at on the links we'll give you later that will kind of fill out those ideas a bit more. Okay. So why nurses and midwives? The highlight notice. In general, only about 8% of bids going to the NIHR are led by nurses and midwives. And nurses and midwives are involved in a number of other bids, but not normally in terms of leading work. So the NIHR is really encouraging nurses and midwives to think about applying for grants in their own right. If any of you are not a nurse or a midwife and are thinking, what about me? There will be other calls coming, which will focus on other disciplines and other clinical areas. The other thing to say is that, medics lead about 4 times more bids than nurses and midwives. So there's a challenge for you. I think the point is that the NIHR would like nurses and midwives to lead more research actively. So this is an attempt to encourage people into the fold, to start getting research funding and to start building that profile of funded research activity. We will talk about the RfPB eligibility, or what the RfPB calls are about a bit more over time. But basically for this call, the standard rules apply. There is a slight difference in the sense that what they're looking for here is the calls to be submitted by a lead applicant and a joint lead. And both of those, a lead two people, so a more junior person, so an early career researcher, and a more senior person with experience. I'm always confused by this statement. It is quite complex, and I think it leads to some misunderstanding, but I will talk a bit about a bit later as well. Both should be nurses or midwives. I think here very much the emphasis is on a more senior, experienced nurse or midwife helping somebody with less experience to gain that experience of holding research funding. The definition of an early career researcher is somebody who hasn't yet been a chief investigator, and the bar is put on funding of £100,000 more. So if you've held smaller grants of less than £100,000, then you would still be qualify as an early career researcher. The more experienced researcher on the team, there's an expectation that they would have held grants of £100,000 or more. Although there's the focus on the core applicants of the more experienced and the early careers researcher, you shouldn't ignore the fact that you might actually need other people around you who have other experience and skills. So there's always a focus on the multidisciplinary team and whether you've got all the skills you need to be able to deliver the project. And at the bottom there's the link to this particular call. Okay. So this is what the process looks like for this particular call, but it's not uncommon for any of the calls that come up 3 times a year. So this call was launched in January. The deadline for the applications is actually the 17th of May. What's slightly different about this call is they put in an expression of interest, which is due on the 21st of April. Now, the expression of interest is done in a document which you can find on the website, and you'll have to email to the program by the 21st of April. You can't submit on the 17th of May under the highlight notice unless you've submitted an expression of interest. The expression of interest is, what do you need to know? You need to know who your team is and some general outlines about your grant or your likely bid. So it doesn't need to be well developed by that point, but you need to have a good outline, a good understanding of what you're going to try and do. This is not used to make any judgments about the quality of the bid you submit in May. It's there purely as an administrative process. And the reason is because the NIHR will be assembling a panel which is specifically relevant to this call. So they're looking to get people in to judge the bids who have experience of nursing research. So they need time. They need to know how many bids are likely to come in, and they need time to assemble those panels. So it's a bit unusual. That bit, the expression of interest, is a bit unusual. That doesn't normally happen in the RfPB process. So in May you submit. There's a committee stage, which is where they scrutinize and triage the bids, and some bids get rejected at an early stage because they don't think they're strong enough in several areas, and you'd be told quite rapidly if that's going to be the case. The first the first panel of the committees considering the bids happen in July, and you would generally get feedback quite quickly about whether you've got through the first stage. You get about 6 to 8 weeks before the second stage call is in. So there you get feedback on whether you've got through the first stage, and also feedback about the issues that they think are relevant in your bid that you need to address for stage 2. So you need to be prepared in August and early September to work on the bid ready for stage 2. Then it goes out to peer review October, November. The panel sits in November, and around about the end of the year, you get a decision about whether you've achieved the funding, or they give you feedback about why you haven't been supported at that stage. There was something else I was going to say. Oh yes, what I would say is, although this particular call is designed and set up for nurses and midwives, there's a call every 4 months, and it's always a common observation that people who miss a particular call but submit to a later round quite often do better because they have more time to develop their bid. The highlights will stay in place for about a year, so I think in later rounds you can identify that you're submitting under the highlight. There is a second observation here, and that is that the remit in general doesn't require that you are supported by a more senior. So if you're an early career researcher, if you apply to one of the open calls, you will not need to be supported by a more experienced researcher. You could be supported by another researcher from another discipline. Now, there's pros and cons to that, and there's very good reasons why this particular highlight call is focusing on having a more senior nurse to support an early career researcher. And I think you can understand that there's concerns that a more senior researcher from another discipline won't understand the nursing issues as well. So I think, you know, that's something to think about and to consider if you are keen to develop a research career, but you're struggling to get that support to be able to meet that criteria. The calls are always there. We're always willing to help and advise and support to help you get a bid up to the standards required. But I think if you can make the deadline in May, that would obviously be great. But if you can't and you're keen to submit bids, there's always later rounds, and sometimes the later rounds will have fewer restrictions, fewer constraints, and might be better for you. Okay. I've put the links on here that will be helpful. So there's the call specifications, a fuller document about what the call's about and a lot of the issues I've been talking about today. There's a webinar that was held some time ago that's really useful. It's about an hour long, and it goes through a lot of the issues I've talked about today, but has also got some Q&A, which is quite interesting to listen to. There's also an FAQ, and I've pulled out a few of the FAQs to talk about briefly before we go on to questions. And that will kind of give you an indication of the issues that people are coming up with and how the NIHR views those issues. Okay. So just some observations. Take your time. The worst thing we have to deal with as advisors, as research advisors, is people who've tried to rush a bid too much. Trying to tell people to delay is always difficult. That's not always a message that's easy to hear or easy to give. But it's better to have a well-developed bid than to have something that's undercooked. I'm not saying that people don't write bids in a short space of time, but it's very rare for those bids to be supported. Make sure you have a good team with the required experience around you. That's always important. You can sometimes get away with that around one, and that comes back saying you need additional people on your team to cover areas. But normally what it means is you'll miss out on some crucial issues that will get picked up, and it will cause difficulty when the panel consider. And as I said, there's a call every 3 months, so you won't be at a disadvantage if you apply to a later call. where you can identify the highlight. But you know, it obviously, if you go to a later call, you have less constraints on how this particular call is specified. So there's things to think about. Okay. The FAQs, I think I'm just about on time. The one question is, how do they define an early career researcher? An early career researcher is generally, there's kind of rubric which has come out, which I've not seen before, is anybody who hasn't held a grant of more than £100,000. But generally, what the NIHR is expecting is applicants to have some evidence of that they can do research. So you should have some published papers, maybe some small grants, things like that. Evidence that you can produce research to the required standard for publication is always a good indication. So if you've started to do some work like that, you started to publish some papers, for example, then you would be considered sympathetically by the RfPB panels. The second question comes up quite regularly is, do I need a PhD to apply? And the answer is no, you don't. Obviously, a PhD will give confidence that you've achieved a certain standard and you've had a lot of relevant training, but not everybody who ends up being an active researcher has gone through that route. And some people seek to get a PhD later down the line, and actually some successful researchers have never got a PhD. But it certainly makes it easier to demonstrate that you've had relevant training. So again, we can help you to think through those issues. What I would say is that if you don't go through the PhD route, you've got to be able to have got some relevant training to help you to understand what the issues are and how to approach research. So one way or another, training is important, and research training is important. The question around, do I have to have a joint lead? So I think this is around the relationship between the early careers researcher and the more experienced person on the bid. How you specify the relationship between those two people is fairly open. They don't have to be joint leads, but that person clearly has to have, the more senior person clearly has to have a commitment to the bid. So there's a certain amount of flexibility around how those roles are defined, but you definitely need a more experienced person there with a significant commitment to delivering the research and to helping the early career researcher to develop their experience of holding grant income. The other common question is whether these grants can be used to undertake a PhD. And the standard answer is pretty clear. It's not unhelpful. There's other research training programs, so there's fellowships you can apply for, and those fellowships are designed to support people through master's, pre-doctoral, doctoral training. So that's the route by which the NIHR recognises the training programs and the route to a PhD. However, if you hold a project grant for a reasonable period of time and you can get support from your institution, there's no reason why you can't register for a PhD while you're delivering a research project. And actually, a lot of us have taken people through that route, so it is equally open to you. But essentially, what the NIHR are contracting you to do is to deliver the piece of research. Your relationship with your institution, which supports you, should they wish to register for a PhD, is separate to delivering the piece of research, but the research can be used to support PhD through that route. This is something I feel less qualified to talk about, but the question is, do I have to be a fully clinical nurse to take part? I think this is about people who are in clinical practice versus people who are, say, in an academic institution or in a third sector organization or whatever. There's a number of places nurses might work and exist. The answer is that those divisions are not important. What's important is whether you qualified as a nurse and whether you're doing something that is relevant to nursing. So where you work, how you work is not so important as your basic clinical qualification and what you're trying to do. Okay. I've put the links on there, the link on there to the other FAQs. There's a lot of FAQs that you can go through in it, which might answer some of your questions, but you can always come to us and ask for guidance, and you can always email RfPB as well and ask for guidance. So there's lots of opportunities to get guidance on this. And there will be other calls in due course, and especially calls for other groups of people outside nursing and midwifery. So okay, I hope that's given you a flavour of some of the things that people have been asking. And now we go to any questions. And I presume I will have to find the chat, the Q&A function, so I can see that, which I think I have to stop sharing.
Hi, David. I was wondering whether we can perhaps listen from Jeremy before we go to the questions and answers, because he needs to go at 11.
Right, okay, yeah, sorry.
Just about,
okay.
I mean, we can wrap up all the questions after that.
Sure.
That'll be great.
Okay.
Thank you.
Sure.
Actually, the meeting that I thought I was going to have to go to, I'm not having to go to now. So put my video on anytime you want to.
That's great. Thank you so much, Jeremy.
You want to do that now, Jerry, or shall we? I
mean, if Jeremy is not really going for his next meeting, we can perhaps have questions and answers now, if that's what you want. That's
okay,
fine.
Sure. Well, we'll go for that then. Okay, good. So I'm not sure whether people have been posting on Q&A. I'm just having a look here. So right. So Louise McCarthy is making an observation. There's a lack of co-leads with sufficient experience grants on CV to mentor less experienced applicants. Is there any advice we can give? I'm sorry, this is, yeah. I think this has occurred to some of us as well. One of the problems we're going to have is finding the more experienced nurses around who have the capacity and the time to supervise more junior nurses. And that is a real issue. And that's why I've been saying there are other calls where that remit is not specified. So you can submit to an open call where you have other advisors. I think the real problem is ensuring that you get supported as a nurse addressing issues which are relevant to nursing and not relevant to the more experienced researcher, and that's always going to be a bit of a battle. So it is a problem. I'm not sure there's easy ways around. Jean wants to jump in there.
Yeah, I think I'd also just add, David, thank you. I'd probably just add that there are pockets of expertise around, and I think we should recognize that, and we don't need to only stick with our own region. So if there's somebody, a nurse who's doing research in your particular area and she's further afield, that's absolutely fine to pair up with them. It may be a little more challenging for you to manage it, but that is a possibility. Also, NIHR Academy has a cadre of nurses that we could consult with to find people with expertise in your field. And I guess the higher education institutes do have nurses that are carrying out research in particular areas. So I agree with the questioner that you know, if there's a shortfall of nurses, where do we go to? But there are pockets, and I think we mustn't underestimate the volume of support that is around, and we just have to find it.
It is nevertheless going to be a bit challenging, and I think that's something we need to acknowledge. The questions that people are asking in the webinar are on the Q&A button at the bottom, if you haven't found that. So if you're looking in chat, I think chat's is restricted, but the Q&A is there if people are struggling to find that. But I think Emily has posted the links helpfully. Can you post the links on Q&A, Emily, rather than on chat, so that people can get access to those? I'm not sure we can see the chat here. So, okay, so it's Q&A, which I'm looking for through for questions. I'll have a look and see if there's anything on chat, actually. So, okay.
Can I just in the interim ask Louise if that answered her question all right? Or Louise, is there anything else you wanted to ask relating to expert nurses, people who have got more of a track record? Oh, we can't hear you, but thank you. Louise has put thank you. I think we've answered it. Thank you.
Okay. Okay. So, okay. So I'm just looking through to see if I can find any other questions in there.
I can help you, David, because the one that's just come up from Abimbola, are there any useful links on how to develop research ideas, please? I've got lots of suggestions for that, but I'll keep quiet for now.
Well, yeah, carry on, Jean, if you've got a good answer to that one.
Abimbola, thanks for that question. It's a really important one. So if you're struggling to come up with a research idea from a clinical setting, one thing to think about is there's the James Lind Alliance, and perhaps Emily can post the link for me while I'm talking. They have priority setting partnerships where they bring together members of the public, patients, carers, healthcare professionals, etc., to try to prioritize research questions where there are gaps in the research that for particular clinical topics. So if you work in a particular clinical field and you're interested in a particular condition, you could have a look on the James Lind Alliance website to see if they've come up with priority questions that they want addressed. One note of caution is that where they do come up with those questions, they're often fairly broad and not quite answerable in the format that they're in, but we can help you. If that's an area that you have interest in, then we can help you think through how to refine those questions a little more. There are other ways of finding questions. So NICE guidance often comes up with recommendations for where further research is needed because they've identified the gaps. And I can find the link once I'm finished talking and post that. Systematic reviews. So for example, Cochrane systematic reviews, they come up with recommendations for future research. So if you're aware of a systematic review that is in your area, then they often have those recommendations for research. But bear in mind that first organization I was talking about, James Lind Alliance, they will look at systematic reviews to identify the gaps that have been highlighted in those reviews and then prioritize them. So sometimes you only need to go to James Lind Alliance. You don't need to backtrack to the original systematic reviews, if that helps. Happy to talk more in the future, Abimbola.
Yeah. You can also come to the RDS and ask for advice and guidance as well. And there's people like me and Jean around, Jerry, to give you guidance and support. Okay. Other questions? Were there any other questions that are coming up? So I think both chat and the Q&A is up and available. useful links. Okay. Nothing that I can see that's coming up. I'm not sure anybody else has seen any questions.
I think we've answered. I think there aren't any further questions coming up just yet.
Okay. We'll keep an eye on any questions, so please feel free to post any questions either on chat or the Q&A. But let's move on to
David, can we just
Jeremy.
take one more from Abimbola? Can two early career researchers develop a bid with a more experienced researcher? So the guidance is requesting one early career researcher and one more experienced, and then your team around you. And really, you would want an experienced team around you. That's my take, David. Do you have anything separate?
So I would say in principle, yes. The issue is going to be around the amount of funding that you have available, and actually finding sufficient time for two people is challenging. So that's going to be the main constraint. But doing it as a, sharing the responsibility of lead between you, I think is something that you should consider, but it's going to present challenges as well. I don't think it's absolute, it wouldn't necessarily fall outside the remit, but it's going to create some issues that you need to.
Yeah, and I think they're very clear that they want an early career researcher with a more experienced one. If they're going to have co-leads, it should be that combination. If you're having another early career researcher on your team, as David says, you might be excluding somebody with more experience because of the cost envelope. So that may be a bit tricky. But
I think thinking through how that might work would be something you'd need to do early on, and decide whether you can make it work or not. It's going to be difficult, but it's worth asking, I think. Okay. I think if we can move on to Jeremy's presentation now, that'd be really useful.
Jerry, do you want to put the video up? Because I don't suppose I could improve on that. Would that be a good idea?
Tanya, Gemma, do you have the video I sent you? Just try to find it out myself.
If not, I'll try and find my talk in my records and deliver it live. Hang on. There we go. I can deliver it live if you'd like.
That'd be great, Jeremy, if you can.
Okay.
Thank you.
Thank you.
Hello, everybody. The NHS has never had so much money as it has now, and yet the NHS has never been in the state it is now. Ukrainian refugees are reported to be returning to visit the Ukraine for healthcare, as has been predicted for decades. The NHS model is unsustainable, and as we are now seeing, patient care is significantly compromised. But while there are examples of excellent care, there are examples of poor care and many examples of indifferent care. Job satisfaction in nursing and midwifery has never needed as much an injection of adrenaline as today, which is why your ambitions to enter the world of research has never been so important. In 2021-2022, there were 12.8 million finished admission episodes in the NHS. In 2020, there were 681,560 live births in the UK. All those patients would have been more exposed to nurses or midwives than they were exposed to consultants or junior doctors. And yet, when people think about medical and surgical research, it will be doctors that patients think about before they think about nurses and midwives. The profile of nursing and midwifery research needs to be more visible. The activity of midwifery and nursing research needs to be busier. Patients should be able to associate research more readily with nurses and midwives as they do with academics and doctors. The NIHR recognized there is an imbalance of research and funding between the medical profession and everyone else, which is why they are undertaking a review to promote other professions to encourage them to undertake research. And there are opportunities for all professions: medicine, surgery, physiotherapy, occupational therapy, nurses, midwives, speech therapists, dietitians, operating department practitioners, everyone to put forward a research proposal. I've recently sat on an NIHR funding panel considering applications from parts of the NHS and social care sectors that traditionally don't see money coming their way. So the enthusiasm for funders for more excellent research applications is there, and you need to match that enthusiasm by designing a proposal that will have a tangible patient benefit and that will save the NHS money and would be a great use of scarce research funds. It is doable, it is achievable. I support research as a member of the public for more teams and organizations than I can count, but among them, there are some fantastic nurses. 2 examples. I work with Natalie Patterson, Professor of Clinical Nursing, in my role as PPI lead for the UK Critical Care Research Forum. And also Karen Ainsworth, the lead research nurse at South Tees Hospital, doing cardiac surgery research. Both are equally passionate about raising standards of nursing care, and it is the standards of care that patients experience first of all. Patients don't notice if their admission forms are missing key data. They don't notice if their fluid balance chart hasn't been filled in. And they don't notice if their computer record includes whether they're taking vitamin D in winter or not. What they do notice, and what matters to them, is if they are cared for by people who care. They notice if it matters to you, if they recover. As a nurse, I worked with nurses who were only doing the job because it was an easy way to earn $25,000 in the dry and meant they could spend hours behind a computer. As a patient, I'm looking out for nurses who don't observe the rituals of nursing without thinking about the person who is a patient. And the thinkers are people like you, people who really want to make a difference because they know you know what it is that creates the difference between great nursing and midwifery care and someone who just turns up for the day. Getting funding for research isn't impossible, but it is challenging. Funders, reviewers aren't looking for reasons why an application should be funded, but instead we are looking for reasons why we shouldn't fund an application. And only when we can't think of a reason, do we recommend that a project gets the money requested. Part of the funding application necessitates proof that the applicants have included patients and members of the public in being consulted about the research question in designing the research plan, and will be included as part of the research team for its duration. What this means is that if you want to conduct research, you will need to get used to including patients and people like me. To midwives, I would add, don't neglect to include fathers in your plans, because as with all other research, what happens to patients has a consequence to those closest to them. Your research may be into the welfare of mothers and babies, but don't make the mistake of leaving out fathers. Research should be done with us, not to us. Research produces evidence, and evidence carries with it an authority that you, as nurses and midwives, should be exponents of promoting. Authority that should challenge nursing and midwifery ritual. I started my nursing career as an auxiliary on an orthopedic ward, and I was bewildered to watch colleagues, trained and untrained, liberally drench female patients' pudenda with talcum powder. I was told it was because it makes the skin soft and because we've always done it. We now know the tragic consequences of practice that is just ritual, that isn't evidence-based. In beginning a career in research, you will be able to influence others to focus on research-based practice and challenge the rituals of practice. People like me, and let's face it, everyone is only a heartbeat away from being a patient, deserve to be cared for using the best principles and practices of care. And the best principles and practices are not always found in the protocols gathering dust on ward shelves. Often protocols are there not to protect the patient, but to protect the system and punish the member of staff. So use your skills to change principles and protocols for the patient benefit. Research has to put the patient first, not the system. Don't be afraid to ask patients and the public what they think about your ideas for research. We will be honest with you. Ask friends and colleagues, and you risk them lying to you for fear that you will be disappointed with their answers. Ask your patients and the public, and we have no axe to grind. You can find us in patient forums, in patient panels, the Citizen Senate through websites such as The Voice or People in Research, in outpatient clinics. We are not hard to find, but ask us you must, because if you don't ask us, you will waste a lot of time, energy, and a funder won't fund you. I wish each and every one of you success in your research endeavors. And if I can help further, you only have to ask. Thank you for listening.
Thank you, Jeremy. I should have given you a brief introduction there, but Jeremy is an active patient representative, public representative who supports us through a lot of bids and always has interesting and challenging things to say. I'm not sure whether there's any particular questions for Jeremy, but I think we had originally planned for a brief break here, and I think it is important if we have a break for 5 minutes or so, and then come back at 10 past to when Jean will talk to us about what the RDS is and what support the RDS can give you. So I think what we do then is if you post any questions for Jeremy, we can bring those back towards the end when we have a more general question and answer session. Thank you. Speak to you in about 5 minutes. Are people back?
Do we know?
Okay, we are.
Okay, great.
We are on time now.
Okay, perfect. So morning again, everybody. I don't know how to quite follow Jeremy's fantastic presentation. I feel so enthused by what he was saying. It's just wonderful. Thank you, Jeremy. I'm going to just briefly mention the Research Design Service and how we can help you when you go through this process of applying for research grants. I'm a research advisor with the East of England Research Design Service. And my slides won't move. So what the Research Design Service can offer, it's a free service. There's no fee for our service. And we offer an advice and support to absolutely anyone who's wanting to undertake applied health and social care research. And I say anyone, it could be nurses, midwives who are on this call, healthcare practitioners in any role, advanced health, AHPs, academics, doctors, dentists, etc. The point is that it's applied health and social care research. We don't really have the expertise in our teams to do basic research or animal studies, etc. That's outside of our remit. And what we really hope to do is help you turn innovative research ideas into strong applications that are successful in getting funding. We are funded by the National Institute for Health Research, so that's the research arm of the NHS. And so ideally they want us to help you to win their money. So for example, research for patient benefit funded money. But we also can support people who are applying for funding from other NIHR partners, so some of the large charities such as the Stroke Association, etc. And really what we're helping you to do is trying to help you win funding to deliver projects that have real potential for bringing about benefit to patients, to carers, to the NHS, to social care, to local authorities, etc. the RDS is a national organisation, and there are a number of regional RDSs around England. We cover together the east of England, and we're 5 different sites, but we very much work together as a team. It's just that if you happen to come from, for example, Norfolk, then you will come to the group that are based at the University of East Anglia. We've got another group based at Cambridge, University of Bedfordshire, University of Hertfordshire, and University of Essex. But we all very much work together and share our knowledge and our expertise. And like we're doing today, we're from different sites around east of England here. We are made up of people with various different areas of expertise. So we've got research methodologists, we've got health economists, statisticians, qualitative researchers, people with health psychology and behavioral science expertise, people with systematic review expertise. Some of our research advisors have clinical backgrounds. For example, I'm a nurse from a very long time ago. We have advisors that have specialist expertise and roles in patient and public involvement and engagement in research. We have research champions for some of the more specialized funding programs. So within the NIHR, for example, there are multiple funding programs, multiple pots of money, and some of them are a little more specialized than others. And so we have people who have who really are making sure they're upskilled in all the minutiae of those particular funding programs. But all of us research advisors in the RDS East of England advise on a wide range of clinical and methodological projects, and we advise on programs for all the different funding programs, all the different funding schemes within the NIHR, and on other charitable funding programs. So we're familiar with the rules and requirements for each of the funding programs within the NIHR. Some of our advisors in our RDS East of England team sit on funding panels and help make decisions on the applications. And most of us have observed funding panels. We get the opportunity, it's quite a privileged position really, to sit in on a funding panel and observe the whole process and to really see what the funding panels want. And I absolutely concur with Jeremy when he says that the funders want to fund research. They really want to find if there are faults in applications, they want them to be fixable faults and really to try and help facilitate funding really good research. I mean, they don't want to fund stuff that isn't a well thought through or where the case isn't well made, that it's going to have potential benefit. But if that case has been made, then they really do want to fund it. And as research advisors, we have a wide range of research interests. Many of our advisors are doing their own research projects in particular areas. So we draw on all that knowledge of observing funding panels, of our own research interests, of having worked with people for a long time on research projects and worked with people trying to help them be successful in their funding applications when we advise people who come to us with their projects. And I've put this picture in just because here I am with natural colored brown hair. I'm now gray. I've been with the Research Design Service for many years, and many of us have, and I think that's a real testament to what a lovely organization it is. People really are trying to be supportive to investigators that come to us. We try to be a critical friend, not a, so come to us because we're there to be supportive. If you're in the very early stages of grant application development, the way we work is really trying to help you make a strong case for the research. And that's very much about understanding what you know about the problem, the nature of the problem, the size of the problem, the impact that this problem has on patients, carers, NHS, social care, wherever the research setting, and really helping to tease that all out. And looking at whether you can make that strong case that this is an important question and that it has the potential to bring benefits if the research were to be undertaken. And at the early stage, we then help you to refine the research aims and objectives, and we signpost you to experts in the field and people who could potentially come on board as co-applicants. So that's all very early stage, because those co-applicants and experts in the field will further help you refine the research aims and objectives by bringing their own knowledge of the existing evidence-based and being clear that your question is at the right point. And then as things progress, once it's apparent that there's a strong case for the research, we will help advise on the design of the study, the methods that you could take to deliver the study. We look very carefully at what is the most appropriate funding program, because there are differences for all the funding programs, and it's not always clear cut whether the study fits, where the study best fits. We can help identify and engage relevant methodologists. So if you need a statistician, we know where to find some. We can help with the work towards your patient and public involvement. So really helping you to get up to speed with what that is, with planning how to undertake patient and public involvement activities, pointing you in the right direction of various groups or individuals that may help. We also will help you think through the costings of the study. There are three that, well, I won't go into it, but there are things to think about, particularly when you're thinking about any intervention and the excess treatment costs. And if those are going to be vast, and if it looks like the NHS, if it's a new intervention that's going to cost a vast amount and you haven't really thought through, and we can help you think through whether this might look just way too ambitious for an NHS that's strapped for cash to introduce. We start thinking about different approaches to that. An important thing is thinking about the route to benefit, and if you can spell this out in a way that helps any funder to understand that you have clearly thought through how the findings of your result might actually make a difference, might be implemented. So for example, we'll get you to start thinking, if it's a training program, is there already a training program that the healthcare professionals undertake that you could slot yours into? So it's not about setting up whole new systems and structures, but you've thought through how to embed the approach for disseminating your results into practice. And we can give you advice on innovative ways to disseminate the findings of your project. And all the way through the development of a grant application, you need to be speaking to the right people in the right organizations at the right time, so we can signpost you to that. We have loads and loads of resources, and we try and signpost you to the correct resources. Just talking about the signposting to the right organizations, it's so tricky if you're new to research to try to understand all the infrastructure around developing a research grant application and who you need to go to at what time point. There are lots of different groups. There's the NHS R&D, there's the university R&D, there's things like a clinical trials unit or the epidemiology center, which may be relevant for your particular study. There's the clinical research network, who are the, once you win the funding, then the clinical research network, if the project is an NIHR project, for example, then they will help to support you with coordinating and supporting delivery of that study. But they really need to be brought on board with the discussions very early on in the grant application, fairly early on in the grant application, so that they know they have capacity, so that they help you with the planning, they help think through the costings that they have to provide, etc. So we try and get you in touch with these groups at the right time. I won't say more on that right now. In terms of resources, there's a wealth of wonderful resources, depending on what your study design is, your methodology, resources for public and patient involvement and engagement, resources to help you decide on outcomes, on the methods, etc., on whether or not you should be doing a feasibility study in advance of a full-scale study. And we really can help suggest useful resources to you that can help you build your application. So how do you come to work with us? Really, you just complete an inquiry form, and it's what we would like is for you to have a research idea that we can't help give you an idea. You need to have some sort of idea of what it is that you want to be investigating. Many people come to us with a question. It might be a fairly loose question, and they've done some background work to understand that there is a need for that question to be answered. They then complete the inquiry form, which is available through that link, and that comes automatically to the right site within the RDS of East of England, and a researcher advisor contacts you to arrange a first meeting, And at that first meeting, which could be an online meeting, we start with trying to understand the importance of the problem, the importance of the question. We try to glean from you what existing evidence is already there. And we might, depending on where you are in your thought process, we may move beyond this at the first meeting and start to give initial thoughts on their design, etc. Then as the study evolves, we're very happy to join team meetings. We comment on drafts, multiple drafts, and near submission time, we will proofread the final draft as well for you if you send it to us in good time. And during this whole process of this whole trajectory of you developing the grant application, we would involve our other advisor colleagues who might have a different expertise to the lead advisor who you've been assigned. So we might bring on somebody with process evaluation expertise or a health economist, etc. We will start identifying methodologists to help you join your team. We'll signpost you and liaise you to other organizations, and think about helping you with your PPI. If you're applying for a fellowship, so I know this call is mainly about the RfPB call, but if you were thinking of applying for a fellowship, then we can do exactly the same. We don't take the role of a supervisor. We're an additional support in developing your application, and we really recommend that we have joint meetings with the supervisors and you as you develop your grant application, so that we're not pulling in different directions, and so that if we do come up with different suggestions and ways of doing things, that we can thrash them out in the same meeting, because there is no one right way of doing research. Other options that the RDS, of support that the RDS provides, we have a pre-submission panel. So if your application is just about ready for submission, then you can submit it to the regional pre-submission panel, and a large group of us have a look at it, we review it, and we give you feedback. You don't need to attend there. We don't have a facility for you to attend, but you get feedback from that. And the feedback may say, we recommend that you delay submitting for the following reasons, or looks like you could turn it around in time, but these points we really think should be addressed. For those applications where there's a mock interview, so one example is a fellowship application, an interview as part of the funding process, the funding decision process, we can offer a mock interview. So that's a very useful thing. Everybody should go through mock interviews. We offer a national grant writing retreat that's once a year, and actually that's happening right now. It's a residential event with a small number of research teams to help them progress their applications. We also offer funding towards the costs of public involvement in research development at the grant application stage, because you need public involvement in designing the studies, thinking through them, deciding on the questions, designing them, but there isn't money at that stage. You haven't yet won the grant. So the Research Design Service has a small fund of up to £350 to help support that. And then we offer events such as these, where we help to give information about funding opportunities. I just quickly wanted to, for Abimbola, who put up the question about research ideas, where to get them from, James Lind Alliance, here's an example of some emergency medicine priorities in the top 10. What's the best way to reduce the harms of emergency department crowding? Number 2, is the traditional emergency department the best place to care for frail elderly patients? So they aren't tight research questions, but they're examples of them. Nice ideas, nice for research ideas. So for example, on this nice guidance NG212, which is mental well-being at work, you can see they've got key recommendations for research there. So that's a good place for finding them. And then interestingly, the NIHR, they are willing and ready to fund research examples that have been triggered by the James Lind Alliance Priority Setting Partnership and by NICE guidance prioritized topics. And so that's just highlighting yet again, that's an important place to get to think about research questions or your research ideas being supported by those two groups. The other thing the NIHR has is themed calls, and any of those themed calls should help you think, oh, these are areas ripe for research, because that's why the NIHR have created them as themed calls, because they've recognized there's a need for further research in these areas. So they're just topic areas, but they remain, these ones that I've put up here remain relevant, important topic areas where research is needed. And the Cochrane reviews, recommendations for research in various Cochrane reviews. So that's all I was going to say, and I'll stop sharing and happy to take any questions on that if there are any. Have I stopped sharing?
You have. I think we're going to, what we're going to do is go on to Sarah now, and then have questions and answers after that. So thank you, Jean. So I'd like to welcome Sarah, Dr. Sarah Vollum, who's kindly come to talk to us about her experience of applying for research funding and gaining research funding and delivering a project. So I'll hand over to you, Sarah.
Thank you, David. So I'm just going to share my screen, hopefully. There we go. Can you see that okay? Can you see my slides?
We can see the presenter version, not the
Oh.
we can see your notes and things, but there you go, we're on it now. That's the one.
Great. Thank you, David. Thanks for inviting me to speak to you all today. My name is Sarah Vollum. I am a postdoctoral nurse researcher at the University of Oxford and also a reader in nursing, midwifery and allied health professionals clinical research at Oxford Brookes University. And my role within Brookes is to develop capability and capacity for nursing, midwifery and allied health professionals led research within the trust and across into Oxford Brookes as well. So I spend a lot of my time kind of talking to nurses and midwives about their research interests and how they can get involved in research. Just in terms of my my grant experience, I have previously held an RfPB grant as a co-applicant, which is my PhD project. I am currently applying for a programme grant following on from the RfPB work that we've done. I'm supporting a midwife applying for this call for RfPB. I'm also a theme co-lead for our Oxford Biomedical Research Centre. So lots of different kind of experience of different NIHR funding schemes. So I'm going to draw on my experience in securing and applying for NIHR grants, which is kind of why I'm here. So I just wanted to give you a very brief overview of Reflect, which was my RfPB project and PhD project, just so that you can kind of understand what I'm talking about as I give my examples through the presentation. So this was a mixed method study aiming to provide a comprehensive assessment of post-ICU ward management. I conducted the work over 3 NHS sites. I conducted a retrospective case record review where I reviewed the notes of 300 patients who were discharged from ICU and subsequently died in hospital to kind of look at the common problems in care that may have contributed to their deaths and therefore the kind of areas where we could improve care. And I also interviewed 55 patients, relatives and staff about their experiences of post-ICU ward care. And I took all of that information together and developed stakeholder meetings to draw on some of those particular common problems in care delivery to map the process of care and look for how we can improve the kind of general outcome for post-ICU patients. And kind of the long-term aim of this work is to develop an intervention to improve post-ICU outcome. And that's kind of what's feeding into our next funding application. So securing funding for the Reflect project wasn't straightforward. It was third time lucky for us. We had 2 previous attempts in securing funding, first as a programme development grant, which wasn't successful because I think the feedback really was that it was such an unknown area of care. There's so much research going on in ICU, but kind of a complete lack of any information about what happens to patients in post-ICU in hospital. So we just weren't quite ready, quite there in terms of a programme development grant. I also applied for a clinical doctoral research fellowship, which is now the NIHR DCAF fellowship scheme, and again wasn't successful with that. With the feedback that the project was perhaps too big for a PhD, and there was concern about me delivering the project, which hopefully you'll see later on I did manage to deliver. But we were finally successful with a doctorate in my research department in securing the RfPB grant. And I just wanted to kind of highlight here the kind of statistics for securing RfPB funding. So in the last year, only 20% of applications were actually funded by the RfPB. But if you look at applications that went through to stage 2, that's 59% of applications. So if you've got a really good, robust application that fits the criteria and gets through to stage 2, then you have got a good chance of being funded. And working with the RDS, I think, is a particular recommendation for kind of managing to get through to that second stage. But nevertheless, securing research funding is definitely challenging, and it really does require quite a lot of resilience. So if you aren't successful the first time you apply for funding for a project, then please don't be disheartened. Don't just think, this is never going to happen. You should get really useful feedback if you aren't successful in a grant application, which you can work on to develop a fundable bid. And again, working with the RDS with that feedback will really help you to move on and secure funding in the future. So David's covered a lot about the RfPB remit and focus, but I just wanted to kind of reiterate that the remit for the RfPB is to fund topics and research methodologies that increase the effectiveness of NHS services, provide value for money and patient benefit. And I just want to emphasise that completely aligns with what we as nurses and midwives are both interested in and really good at. We're always looking at how we can improve care for our patients and how we can make our services run better. So this is absolutely where we should be thinking about applying for funding. And as David said, there are kind of 3 tiers of funding, and I'm going to talk a bit in particular about the up to £150,000 tier, which is where the Reflect project sat, because that was a high risk kind of exploratory study that had a longer lead into patient benefit, because it was quite early on in kind of developing the evidence base for improving care in that area. So this is just a little bit of a reality check about what £155,000 will get you, and it's not a great deal. So for the Reflect project, it funded us a full-time researcher, so me, for 12 to 18 months, some fairly low percentage salary costs for 3 advisory co-applicants, and then the research costs to deliver the project. And those were things like vouchers for participation for people that came to the interviews and the stakeholder groups, interview transcription, travel to the sites, room hire for meetings. It bought me a computer, some stationery and archiving, and then really importantly, PPI time and training. And I'll talk a bit more about PPI in a minute. So then I'm going to talk a bit more about the pragmatics of applying for the RfPB funding, but just first wanted to make this point, and David has already covered this as well. The stage 1 application is relatively short because, with the aim of not wasting your time if you aren't successful in progressing to stage 2. But the reality is that actually you do need to do a lot of the work that's required at stage 2 to complete stage 1. So you do need to think really carefully, although you don't have to put the detailed costings into stage 1, you do have to have a good idea about how much your project's going to cost in order to give a kind of a total. You do need to think carefully about PPI. So although there's not a PPI section in stage 1, you will need to have threaded your PPI work out throughout your project plan. So that work will need to have been done as well. And as David said, there's only 2 months between the stage 1 outcome for this particular nursing call, and this is fairly standard, and the stage 2 submission. So you need to kind of be ready to go. You need to be pretty far on in everything that you need to deliver for the stage 2 application when you put that stage 1 in, so that you are ready to hit that submission date. So some of you have asked questions about how to choose your topic area. So for me personally, this came from my practice as a research nurse. So and my background as an ICU nurse. So I ran a study that recruited patients with upper GI surgery into a monitoring study, and it was really clear to me when I visited these patients on the ward that transition from ICU to the ward was really problematic, that they were often very sick on the ward. Their care needs weren't particularly well met on the ward, and they often went back to ICU. So that's kind of where my questioning about post-ICU ward care provision started. So from your perspective, think about the uncertainty in your own practice. What would help you if you had additional knowledge to deliver care to your patients more effectively, or to give patients a better experience? Your topic for an RfPB or any other funding application needs to be really clinically relevant, and it needs to have a really clear gap in the evidence. And as Gina's already said, you need to be really clearly articulating that to the funders, because obviously they're investing a lot of money in your project, and so you need to really persuade them that the money that they're going to invest is worth spending, because this is an important area that needs further research. And as the name suggests, you need to think about an evidence gap that by filling it will benefit patients in the short, or if you're thinking about a tier 1, the kind of medium term. So you need to think about what that patient benefit is, and you need to, again, really clearly articulate that in your application, so that it's clear that your project fulfills the remit of the grant and that it's worth investing in. And you need to make sure that what you're researching is something you're really passionate about, because even if you only looked at this topic through the course of this grant, from the point of thinking about starting to write a grant to the end point of a grant, it's going to be many years. You're going to spend a lot of time on that. So you need to make sure it's something you do really care about. Again, other speakers have talked a bit about co-applicants, but for me, I was lucky because I already worked in a research department. So there were area topic experts around me, but I'm working at the moment with a midwife who is hoping to apply to this call, and that isn't the case for her. We don't know a midwife locally who could support her. So she has worked really hard at contacting lots of different people throughout the country who topic areas for her particular question to look for. As you say, the midwife researchers who have that level of grant funding, but also the expertise in their field. So yeah, look outside your organisation and contact people. People are really willing and keen to support new researchers. So it's always worth emailing people to see if you can set up a meeting with them. And you need to look for methodological experts who are going to support you to deliver your project, as well as the topic experts. And considering the constrictions of the funding, ideally you want to be thinking about methodological and topic experts, so people that offer both of those things, because you are going to be very tight for funding. But overall, when you're looking for your co-applicants, you need to be thinking about what support you will need to deliver your project successfully. And again, you'll need to really carefully justify that in your application, so it needs really careful thought. So when you're developing your project plan, as David has already said, you need to start really early. It takes a long time to develop a co-applicant team around you and develop a really robust project plan. So talk to loads of people. So again, the midwife that I'm working with has contacted loads of different people, both methodological and topic experts. And we were talking yesterday, and she said that every time she speaks to someone, her project moves forward, it evolves a little bit. She gets a little bit of a different perspective, a different idea. So it's really worth kind of talking to lots of different people, whether they're topic experts, methodological experts, or just your colleagues or your friends, just to keep thinking and evolving your project as you go along. And as I've already said, seek out those methodological experts, and absolutely engage with the RDS at an early stage. If you've got what you think is a good idea, do go along, kind of start thrashing out some of the ideas, some of the things that you think may be able to address the problem that you've identified, and they will really help you to develop those ideas. And just want to say one further thing: don't be disheartened if you do find that there are other people in your space doing similar types of research, or more importantly, implementing things in practice without the kind of evidence base that you would like to see, or you're trying to develop for your project. if that happens, think about how what they're doing is different to what you might be doing, and whether there's space for both projects in your field. And if there isn't, think about how you can collaborate. That may well be a way in which you find new collaborators and new support for your research. So just, do engage as much as you can with other researchers. I'm not going to talk too much about methods because I don't think that's really the purpose of this presentation, but what I did want to draw your attention to is if you're thinking about using qualitative methods for a research project, is to really encourage you to access this YouTube video. It's an NIHR webinar called Discover Funding Opportunities for Qualitative Researchers, which was held recently. And in particular, you can hear Marion Knight, who's the director of the Research for Patient Benefit Programme, encouraging more high quality qualitative research applications. So, there's a real drive at the moment from the NIHR for more qualitative research to be undertaken. And I think as nurses and midwives, we don't, definitely not solely focused on qualitative research, but that is often where that we have strengths in terms of our research, even if we're thinking about mixed methods projects, because we're so used to talking to patients and staff and thinking about the perspectives of different people. So a few more of the kind of practical aspects of developing a grant application. You really need to think about your costings, again, pretty early, because they are going to influence in part kind of what you can put into your grant. It may not influence the scale of your entire project or your entire idea, but it will constrain what you can get into an RfPB grant, and it may be that you need to build on that to kind of fulfill your long-term goal, as I did in my RfPB application. There are lots of NIHR resources available for costings, but I would really encourage you to engage with your finance department early and ask them what they will need from you if you're thinking about putting in a grant application, and when they'll need it. They'll often need, or they definitely will need, your costings at least 2 weeks ahead of the submission deadline, and it might be that they need them before, and it'd be really useful to understand from them the kind of format that they need that information in. And it's worth also trying to find other people that have done similar things so that you, within your particular organisation, so you can understand that process. I would urge you to get your costings, salary costings from your co-applicant departments really early, because that's something that often takes quite a long time and can cause stress when you're trying to put together a grant application, get it ready for submission. To start that process early. And then when you're thinking about costing your project, in RfPB, the biggest cost tends to be the salary for the person who's going to be delivering most of the work, but you will also need to think about all the extra things that you'll need to deliver your project, such as vouchers for participants, transcription costs, server storage costs, that kind of thing. So you need to think about all of that stuff, and PPI, which I'll go on to in a minute. And then the other thing you will need to do, so again, this is something that is required for the stage 2, not the stage 1, but you do need to have done this because there are kind of some cost implications for your kind of main total that you're going to put in your stage 1, is to do the schedule of events cost attribution template. And again, I'm not going to go into this in much detail, but just to say that it's quite a daunting thing when you first look at it, so please don't be put off by putting this together. This is just an Excel spreadsheet that helps you, the NIHR, to identify the NHS costs to your project. And what you need to do is engage again early with the specialists who will support you in developing in filling out your cost template. And they're really knowledgeable and helpful. So if you go to them with a really clear plan of what you're aiming to do in your project, they will really help you to fill that in. So just don't be put off by it. And then PPI, so Jeremy's already talked to us about the importance of involving patients and the public in your research generally, but it is really important that you demonstrate really strong engagement with patients and the public in your grant application, or you simply won't get it funded. So you need to start really early again. You need to you need to think about the costings for PPI engagement within your project, and you also need to consider diversity and inclusion within your kind of PPI engagement as well, to make sure that you are getting input from the whole community that your research is going to be serving. I'm not going to go too much into diversity and inclusion because we've not got a great deal of time, but again, there are lots of research resources on the NIHR website that help you, support you to think about how you can ensure diversity and inclusion in your, both in the PPI engagement, but also in the participation within your project. So you need to make sure that the participants within your project represent the wider community that your research is serving. And there are lots of different ways that you can do that are kind of outlined in the website. And then just finally, I wanted to kind of demonstrate to you that although I had quite a small amount of money with £150,000, actually I believe that I made a really big impact in my field with that grant funding. So from that £155,000, I have published 6 papers that have to date had 82 citations. I'm in the process of writing 2 more. My research has been cited in the Getting It Right First Time report that's just been published based around post-ICU support for patients. I got a PhD out of it, which is obviously great for me. And now I'm seeking further funding from the NIHR to develop that work. But then more importantly, I think these are just 2 tweets just to demonstrate the impact that I've had from the patient's perspective. So Catherine White is the chair of the ICU Steps, which is a post-ICU patient charity. And she has really championed my work by on Twitter, promoting on Twitter and identifying the kind of benefits to the wider community, and also by literally using my infographics in presentations that she's made to identify the kind of ongoing need to improve rehabilitation for patients post-ICU. And I think that's a really important impact for me and demonstrates the authenticity of my work, because it really resonates with patients. And that's the strength of us as nurses and midwives, that's what we can really offer. So just to conclude, my top tips are just to allow plenty of time. And as David said earlier, aim for a deadline, but if you don't think that you're going to hit it, it's not the end of the world to kind of slip to the next round. It's better to do that and give yourself the time to develop a really strong application than to rush it. Use the RDS and NIHR resources that are available to you. There are loads around, and particularly the RDS will be really helpful in signposting you to those. Engage meaningfully with public and patient representatives. That's just, I can't emphasize how important that is, but I think probably for us as nurses and midwives, actually quite natural. Clearly articulate the problem that your research addresses in your grant application so that you can persuade the funders that they want to invest in your work, and absolutely draw on your strengths as a nurse or a midwife. Thank you very much.
Thank you, Sarah. That was absolutely brilliant. I think we might have to ask you back for another longer presentation at some point in the future, because that was amazing. So just to pick up and reflect on 2 points really, and I think not giving up. Success rates are, the chances of being funded on an application are about 1 in 4 if you're doing well. So rejection is standard for bids. And keeping going. If you've got a good idea and people say you've got a good idea, keep going with it. And there's so many examples of people that we've worked through 2-3 rounds of bids and things have been funded. So sometimes you just need to find your feet. But also I'm a real advocate for qualitative based projects, and we've had some funded that are purely qualitative. There's no numbers involved at all in at least 2 of the grants that I've been involved with. So it is possible that the focus is on high quality science, I think. So just looking for any questions, just open to questions. Any other comments from the panel that people want to make? Okay, Not sure there's many questions coming through, but please feel free. There's no daft questions.
I'd just like to say to Sarah, as an ex-ICU patient, I'd be very happy to help on your further project.
Okay, thank you. That's great. Thank you very much.
Someone's asking, Sarah, whether we could have a copy of your presentation.
Of course.
It
Yes,
really was great. Thank you.
Good, good. I'm glad it was useful.
We'll make the presentations available in the next few weeks, I think, so that they're there for people to access. Okay. Oh, Lisa Lisa's raised her hand, but I'm not sure that I can. Are we able to post the question on chat, Lisa? Or are we able to hear Lisa ask a question?
Sorry, it was a mistake, Lisa says.
You're with us now, Lisa, if you'd like to say anything.
No, I'm sorry, David. I did it by mistake. I do apologise, but I think I was leaning over to type to say thank you very much. Sarah and Jeremy were just so insightful. Thank you.
Good.
So Amibola. Are we able to hear from Amibola? There we go. I think if you unmute yourself, Amibola, you can talk to us and ask us a question.
Okay, can anyone hear me now?
We can, yes.
Yeah, thank you so much for that wonderful presentation, Sarah. That was quite insightful and eye-opening at the same time. I just put a question in the question and answer box, and I said, can we see copies of approved applications to have an idea of what a strong application looks like? I just want to know if it's something that is encouraged, and how can we access such applications? Thank you.
So I think if you get in touch with the RDS, you'll be allocated an RDS advisor, and we'll be able to select examples of bids that are useful. The other thing I hadn't done, and maybe I can share the screen quickly, but on the more detailed guidance for this call, there is a list of example projects that have been funded for nursing, and this is really useful to help you think about the scope of what might be possible. And you know, this, I'm not sure there's a trial amongst them, which is great to see. So you know, this will give you a good kind of example. You can also go on to there's a database of NIHR bids, so where you can search through for projects. We'll find the link for you and make sure you get that link. So there's lots of examples that are available, but that website is the specification for the core has that list of bids, which is really useful.
All right, thank you for that. I'll be expecting the link if possible. Thank you.
Okay. I think Tanya might have sent you the link. Okay. Excellent. I'm not sure I'm seeing many other questions coming up now. Oh, there you go. Okay.
Just posted as well. Sorry, David. I've just posted as well the link to the NIHR Funding and Awards database, which Amibola, if you want to search for you can do for that is a database of any projects that have been funded and have been completed or are ongoing and funded by the NIHR, and you can filter by study program, by funding program. So you can filter by research for patient benefit, for example, and other filters, and you can search on a topic area. And what it brings up are abstracts in plain English summaries with a little bit of information about how much funding was awarded for that grant, which funding stream funded it, and then some of them also include full protocols. It depends on the project though.
Thank you so much, Jen.
That was the database I was thinking of, Jean, thanks.
Also, if I could just add that the toolkit I just put into the chat does make your life easier. It enables you and anybody on the team to record PPI activity in your project as the project goes on. And when you are in discussion with the funder about the quantity and quality of the PPI, you've got the evidence there, rather than having to struggle to remember what's happened.
Yeah, I would echo that. I think that's a really important point, that you're engaging with PPI contributors over a number of years often, and it's hard to kind of go back and think about exactly what the impact was of each of those meetings. So yeah, absolutely, it's really useful.
Jeremy, I'm not sure I'm seeing that link. Do other people see it? Sorry if I've missed it.
I can see it on the chat.
So have you posted it to everyone, or just to
No, I've posted it to everyone. I'll put it in Q&A if it helps.
Got it now. Thank you. Got it.
It's Microsoft Teams. Of course, it's going to be troublesome.
It was a bit slow reaching me. Maybe I'm a bit rural.
there you go. So somebody's asking about the makeup of the team. So is there a high chance of an application being successful for funding if there's collaboration with an academic? The answer is not straightforward. What you need to make sure is that you have the expertise on your team. And now normally, if it's qualitative projects, you're going to need qualitative expertise. If there's statistics, you're going to need a statistician. Inevitably, a lot of the people with those expertises are academics, but it's not absolutely necessary. There's people working in clinical practice who are well published in areas with expertise who wouldn't necessarily think of themselves as academics. So the key is, does the person have the expertise, rather than what species of person are they really, I think, yeah.
I guess I'd also say time. So sometimes if you've paired up with an academic who the topic area is an area of their interest, then they may be able to, I'm not saying definitely, but they won't have their clinical competing role. So sometimes they can dedicate a bit more time, just to add to David's comment.
Okay. So, okay, is there anything that the panel would like to say, to add to any of the conversations today?
Only good luck.
Yeah.
And fingers crossed.
I
recognise the question that someone had earlier about the difficulty in finding the experienced co-applicants. So I guess, yeah, this is an opportunity to address that. So yeah, hopefully lots of really good projects will be funded out of this.
I'd echo the good luck there, but and also emphasize that I hope that we haven't put you off from applying. Do get in touch with the Research Design Service when you got your ideas, and at the earliest possible opportunity to find out a way of involving the patients. The sooner you involve us, the sooner we can iron out any massive errors that you see when it comes to describing the patient burden to your project. The later you involve us, the more problematic it can be. But it may seem daunting at this end of the telescope, but it really is achievable. Just be patient, take your time, be thorough, and everything will be fine.
I think
Sounds
that
like a jolly good note to end on.
go on, Jean.
No, I was just going to say that sounds like a jolly good note to end on. Everything
Yeah,
will be
absolutely.
fine.
Yeah,
It's to quote
Mother Julian of
Julian
Norwich.
of Norwich.
Yeah.
Yes, all shall be well, and all shall be well, and all things shall be well.
Excellent. Yeah. So as members of the RDS, so we're always keen to hear from different people and who have good research ideas, and we like to help people through to develop them and deliver strong bids. So that's what a lot of us live for. So we'd encourage you to get in touch and if you're a bit more questioning about whether you're going to go for this or not, then get in touch and we can sit down and talk to you about what the issues are and what the potential is, and give you a good idea of how you could take an idea forward. So don't be shy of coming forward and asking a question. We're generally quite friendly, aren't we, Jean?
Hope so.
We try to be.
Yeah. Good.
Okay. So I think we've made it to 12 o'clock, and thank you for all the panelists for providing such an inspirational set of presentations. And I hope if there's any other questions, then you should have the link to the RDS webpage, and you can always go on there and request support and help, and we'll jump to it and see what we can do to support you.